Welcome back to the Lymphoma and Related Diseases Registry. Today I'm very honored to have Dr. Joel Wight next to me. Hi Joel.
Hi, how you going?
I'm good. Thanks for being here today.
My pleasure. Taking a little bit of time out of my holiday, as you can see, coming from North Queensland down to Melbourne summer. It's still a little chilly for me, hence the attire.
That's fine, all good. Can you tell us about yourself?
Yeah, so I'm a haematologist. Did my original medical school training at James Cook University in Townsville, and a lot of my junior doctor training was done there and in other parts of Queensland before I moved to Melbourne to do my advanced training. After that, went on to do a higher degree, subsequently relocated back to Townsville as a consultant haematologist, where I'm leading up the lymphoma service that we have there, as well as being medical director of the laboratory.
Can you tell us about your experience as a PI at Townsville Hospital?
The lymphoma service in Townsville is pretty big and busy, as you might imagine. Townsville's a very large tertiary centre, although we are very regional. Our catchment area is very, very large, which includes patients from very regional and very remote places. As you might imagine, we have a very large Indigenous population. The experience of running the registry in a place like Townsville is probably slightly different to what it is in the inner city. Our patient catchment is very diverse, and we really want those outcomes to be captured. We know that really all health outcomes, but in particular cancer outcomes for regional, remote, Indigenous patients are inferior to those who live in a city, and what we want is to make sure that those patient outcomes are in fact being captured, so that moving forward we can make sure that we're treating patients from that diverse socioeconomic group as best as we possibly can, and hopefully to close the gap in those outcomes. And the registry is a really important part of that. One of the issues that we have in Townsville is being that we're in a regional centre. Our health service has focused on service delivery. Although things are changing, the research space, clinical trials and registries, we're becoming much more active in that space. But that's only relatively recent. What that means is that for us, we've had to be a little bit creative about how we staff our registry and how we get data into our registry. So at the moment, our registry is housed within our clinical trials unit. In addition to that, we actually employ some medical students. We sat down, we did some training sessions with them, and they're a really valuable resource for us. They work casually, and that basically helps us to get the patient data into the registry.
And I know you also mentor younger investigators to conduct studies.
Yeah, that's right. So we've got some very keen advanced trainees who work with us. We've also got a fellow position as well who works within our clinical trials unit. We are really spoilt for world-leading academic haematologists, almost all of whom are contributing to the registry and who are heavily involved within the registry and within our other lymphoma networks around the country. So being able to get our trainees doing these projects, creating research questions for themselves, looking at data, being able to answer those research questions, and all at the same time being able to contact experts in the field and collaborate with them. It's invaluable training for them if they want to further their career in that way, potentially going on to do higher degrees or fellowships. It's really eye-opening and potentially door-opening for them as well.
You're also involved in the regional rural reference group. How do you think that this can help with Townsville, or what kind of things you can contribute to the group?
The working group really is aiming to see how we can assist regional sites to come on board and to contribute data. I think we're managing pretty well, and I think the experience of Townsville to do our data entry has shown that they're achievable for rural and regional and remote sites. That's really what the passion of that group is. And I think so much of our research is done in a collaborative fashion. In a lot of ways, it doesn't really matter where you are.
Have you got any advice for other regional sites out there?
Really just to get involved. There is a time cost initially for the investigators in order to get the registry up and running at your site. But the data that you can get from it for your own patients is worth it on its own. And I think it provides an exceptional resource for you and your unit. It provides a great avenue for your trainees and for yourself to do real-world evidence research. It helps to ensure that those rural, regional, remote and Indigenous patients are being captured in our registry so that we've got the right data and know how to design studies for the right patient populations.
You must find our benchmarking reports very useful then.
Absolutely, yeah, they're really handy.
That's great. These are all very good advice for us. Thank you, Joe.
Pleasure.
Thank you. We'll see you next time. Bye-bye.
Bye.